Good day, everyone, and welcome to the Americans with Disabilities Act Employer Recruitment Roundtable. We're happy that you've joined us. We've got some great employers, what we call choice employers, who've got a lot of openings and a lot of promotional opportunities. My name is Shami Carr. I'm an advocate at the Disability Rights Center. I just want to make sure you folks know what DRCVI does. We're a nonprofit that works for people with disabilities, specifically with advocacy. We work with people with any type of disability, medical, physical, psychological, pretty much anybody has a permanent type of disability. We help in the areas of discrimination. We also provide information and referrals. We do short-term and long-term assistance, whether it be lay advocacy or legal advocacy. We have attorneys on staff. And one of the other things we do is a lot of public outreach and trainings. And so today, we just want to welcome you again to the ADA Roundtable. Before we start with introductions with the employers, I want to first mention a couple of housekeeping. We do have someone who's watching the chat. We're going to let all the employers talk and present. And at the end, we will have time for question. If you'd like, you can put the question in the chat or wait until it's time and you can raise your hand and we can unmute you. We will be sending an evaluation afterwards. We appreciate any feedback that you can give us to make this a better event. I also want to include all of our partners that help to facilitate and coordinate the Employer Roundtable, amongst other trainings that we do related to employment and disability. I want to make sure that we acknowledge the Small Business Development Center, the Virgin Islands University Center for Excellence in Developmental Disabilities, both out of the University of the Virgin Islands, the VI Economic Development Authority, VI Department of Labor, the ADA Office for the Territory, Island Therapy Solutions, Vocational Rehab, and on a quarterly basis, we have the Equal Employment Opportunity Commission out of the Miami office that does quarterly trainings with us as well. Last thing I want to mention is that DRCVI is an affiliate of the Northeast ADA Center out of Cornell University. That's my alma mater. I worked there for 6 years, and it's a pleasure to continue to work under the grant. The Northeast ADA Center provides technical assistance, training, and materials. They have a toll-free number, which is 1-800-949-4232. And I want to jump in terms of the overarching kind of mission and message today is about diversity and the Americans with Disabilities Act. And we will get a little bit more into that when we start the presentation. But first, I'd like to go ahead and turn it over to our guest speakers to be able to introduce themselves and let them know where they work. Ms. O'Bain, would you like to start first? Oh, you're on mute.
Okay, good. Pleasant good morning, listening audience. Thank you for taking the time out to participate in this session. I am Millicent O'Bain. I am the Territorial Administrator of Recruitment Classification at the Division of Personnel, whereas my major function is I'm the Chief Talent Officer for the GPI. Thank you.
Wonderful, wonderful. And Ms. Williams, would you like to go next, please?
Good morning, everyone. I am Camelia Williams. I am the HR Talent Retention Coordinator here at Snyder Regional Medical Center. I'm also an ADA trainer certified by Cornell University and a few other certifications under my belt. But our main goal is facilitating employment for our community and facilitating best care, best practice for our customers, clients, and patients.
Wonderful. Thank you, Ms. Williams. And Mr. Rideout.
Good morning, everyone. My name is Doug Rideout. I'm the CEO and co-founder of M1 Enterprises. My wife and I moved here about a year ago. We've got 30 years in healthcare experience. We're an employer. We're a workforce development trainer. We've been training people for about 30 some years in healthcare, and we love being here. We're proud to be a part of the community, and we're here to help people that want to help themselves and share with you all the opportunities that are really out there for you today. And we can speak more about that later.
Wonderful. Thank you. So I think most people know a couple of things. One is that there is a labor shortage. And because there's a labor shortage, you know, as an advocate for people with disabilities, we feel that why can't they fill some of that shortage? We have a lot of talent. We have a lot of people with disabilities who are looking for work, and yet they get overlooked or sometimes they they sometimes disqualify themselves because they're fearful of maybe being discriminated. So this is an event to help kind of bridge the two so that we can have employers who are looking to diversify their talent pool, as well as have job seekers with and without disabilities joining to look for potential employment. So with that, I want to ask the first question, and we'll just do again round robin style. I'll just call out each guest. What I will tell the listening audience is this is an opportunity where you can get a job. So please pay attention and maybe even write down some of the instructions that the recruiters give you, whether it's to call them, to email them, to follow up in this process. If you follow their instructions, that lets them know that you could be a potential candidate. If you can't follow those instructions, you will not be a candidate. So it's kind of a little way to find out, making sure that you know exactly how to follow up and how to follow the rules in terms of how to apply. So with that, I'm going to start with Ms. Williams. The first question I have, and again, I'll ask all the panelists one at a time, is a little bit of the history of the hospital and also what is a good fit for your organization. And I know there's many different positions that you have. So if you could just speak in the broadest sense.
So primarily our institution facilitates healthcare, inpatient and outpatient for our community locally here in the Virgin Islands, Water Island, Hassel Island, St. Thomas, and even St. John. We do also offer services to other neighboring islands. And so our vision is to be the healthcare provider of choice for all of the residents of the Virgin Islands and the Caribbean. Our positions go anywhere from custodians to physicians and in between, support staff, certified and licensed staff in different areas and different fields. Our candidates must come in with a minimum of the ability to fulfill the job that they're applying for, meaning they have to have some skill level already for the particular position that they're applying for. And again, we go from all walks of life, all levels of education. So primarily, to fill the position, you need to have some knowledge or willing to learn, because some of the positions are trainable positions. And of course, that requires you being open for training. It also requires you being enthusiastic about wanting to receive that training.
Mm-hmm. And I think you said something very important, because I work with job seekers. They kind of lack enthusiasm when they talk to employers or network or even at an interview. And I think that's incredibly important. Again, we bring this up because almost one of the reasons why employers like to have certain people hired is because they feel like they have a good fit. And so if a job seeker understands the culture and what is considered a good fit, it's a better chance that they're going to be able then to get hired. I'm going to go to Mr. Rideout next. In terms of the culture and the fit of your organization.
The culture and the fit, we get excited about the fact that it fits so many different areas, you know, especially disability rights. I have a personal connection to close friends of mine that have disabilities, and they have been left out in the past. But going forward, for everyone on this that's listening to me here, there's really no reason now why you don't jump in and, as Ms. Williams said, you know, be open to this training opportunities that are out here from all of us. Ms. Carr is here, they're willing to help you. We're willing to help you. All of us are here to help you. But it really comes back to you having that enthusiasm and really no excuses. We're going to remove all these barriers. My vision, my heart is to remove barriers for anyone that wants to do something and remove all the excuses. I've been a dad for a long, long time, and I know how people have excuses. You'll find I'm very passionate about what I do. And I think the sky's the limit for everybody if you're willing to do the work. So if you're open to training, if you're enthusiastic about it, and you want to do better with things, we're here for you, and we'll help you to make it happen. So we're excited about doing this, and we get very passionate about this. So we look forward to hearing from you. And as Ms. Carr said, contact us the way we've mentioned. I put in the chat already as far as how you reach out to me. And it's about remote workforce development. And our vision with M1 is to create a really strong healthcare and advanced remote workforce in the Virgin Islands. For me, the biggest thing for that piece is going to be that so you don't have to leave the Virgin Islands for good jobs. We want to help stop the brain drain. We want to make it to where you can enjoy this beautiful place and not have to leave it. So that's what we're all about. And so I'll go ahead and stop there because I could talk all day about this. I love it.
Yes. I'm with you. I'm with you, Doug. Okay, and Ms. O'Bain, in terms again, the culture and the fit of VI personnel.
Okay, well, first, I would like to say that the Division of Personnel is actually the recruitment arm of the Virgin Islands government. So what we're talking about is we actually promote job opportunities for 26 agencies across this Virgin Islands government. So, you know, okay, plus 10 business partners. And surprisingly, today, Ms. Camelia Williams, their agency, the hospital, is actually one of our partners. And what we have is what you call a one-stop concept, where you're going to see all the positions within the Virgin Islands government under one website. So we all use the same NeoGov applicant tracking system, and we want, and you hear it out here, the Virgin Islands government is hiring. The Division of Personnel is an equal employment opportunity employer. If you feel you can qualify for a position, view the positions, go ahead, apply for the positions. And if you have those transferable skills, bring it. Because again, we do not believe in prohibiting any discrimination. We do not believe in stopping anyone from qualifying for positions. And if you do feel that way, there's always measures to get around in dealing with these things. So again, GVI is hiring. We look forward to you joining our workforce. Thank you.
Thank you, Ms. O'Bain. And just so people know, I think people know, but the VI personnel, VI government is the largest employer. And she mentioned the numerous departments that they help recruit for. And I think most importantly also is the succession planning that's probably going on, which therefore means there's a lot of leadership positions that are going to be open in the next, I would say, within 5 years. And so this is a great opportunity to really understand what VI personnel can offer and see if it is a good fit for you. Okay. I want to ask the next question, which is part of kind of the culture, and it's talking about diversity in the workplace. And I'd like each employer to talk about specifically their ADA policy about reasonable accommodation. You know, how does that work and kind of what's the process? Nothing too extensive, but just to give the audience an idea of one, just like Ms. O'Bain says, that they don't prohibit any discrimination, that they have a policy in place, not only for non-discriminatory policy, but also procedural, which that means reasonable accommodation. So if you could just briefly speak to your reasonable accommodation process so that people, again, in the audience, if they have a disability, know, one, that you're open to that and that you have a process. Okay, I'll start back with Ms. O'Bain.
Okay, well, thank you for that question. Well, I want to assure you that with the Virgin Islands government, if you apply and when you apply for position and you meet your qualification, we ask that you do not have to outright say whether or not you have some sort of disability, because you have to understand that some disabilities are visible, whereas others are not. Until there's a conditional job offer, then you go ahead and you mention that to the employer, because at that time, then they're going to have you provide you with a conditional job offer. Now, when you speak about reasonable accommodation, we're talking about if indeed you need assistance with the application process, we have a kiosk in our lobby that would allow for that. You can always make an appointment with anyone on my recruitment staff, whether St. Thomas or St. Croix, and they'll allow for you to be able to they'll provide assistance to you. Now, if there's anything else that you need to bring to our attention, please feel free to. But again, you have rights with a disability. We make sure that we are in compliance and we promote that throughout the Virgin Islands government to all of our hiring managers to ensure that everyone is given an equal opportunity. Thank you.
Yes. And Ms. O'Bain said it correctly in terms of equal opportunity. Some people think that reasonable accommodation is a leg up, or it's a favoritism, or you get extra something. You don't get anything extra. It just gives it levels the playing field and gives an equal opportunity, equal employment opportunity. Okay, so thank you for that. Mr. Rideout, I'll have you go next.
I can answer that by an example. Some of the disabilities, I think we all have some sort of disability. I know I do, but I'll give an example of people with autism. It's kind of the silent, hidden, disability out here. We have people in the coding world working remotely. They're autistic. There's people that all these different disabilities, but when you're working remotely, I don't know it. As long as you can do the job, I don't know it. That's on you. So as long as you're going back to what we said before, what Ms. Williams said, as long as you're open to the training and you do what you need to do and you're enthusiastic about it and you can do the job, we don't discriminate, no, because we don't even know, but we also have scenarios where people come to us that they get through the processes, the government processes, and they share with us later on, well, I do have a disability, here's the issue. And that's where working with Ms. Carr has been so wonderful. We've reached out to her on a couple of cases and said, here's the situation. And then we're trying after the fact to try to get them accommodations. And in some cases, we've just purchased the accommodations ourselves. So I guess in a nutshell, if you're working remotely, it doesn't really make any difference as long as you get the job done. So there's no discrimination at all when you're working remotely or with M1 at all. Okay.
And I met Doug, it's been over a year now, and I met him at the mall with some sort of outreach we were doing. And when he told me about his program, I said, I cannot imagine how many people with disabilities who could benefit from this in terms of flexibility, the remote. And like you said, maybe their condition would need accommodations, but if they work at home, they don't need any because they have their own home to be able to be accommodated. So remote work is definitely in. And also, just so you know, remote work is a form of reasonable accommodation. That was a policy that was, or an enforcement guidance that was issued by EEOC actually almost 20 years ago. So remote work is in, and it can also be an accommodation. So thank you, Doug. And Ms. Williams, in terms of just diversity and the ADA policy, in terms of reasonable accommodation.
So here at Snyder Regional, we do not discriminate. We have done a variety of things since I've been on board to ensure that we can reach all community, particularly for individuals who are hearing impaired, individuals who are speaking a different language, who needs accommodations with respect to that. So for instance, if someone comes in who's hearing impaired and they wanted to apply for a job, we have mobile interpreters. We also have engaged with physical interpreters who are in contract with us and who will come in if need be to assist with interpretation services for our deaf community. For instance, I can use an example of one of the young ladies who came in to apply for a job here with us. She was hearing impaired. Once she came, she asked for assistance. We utilized our mobile interpreter to initially make contact, ask her the questions, answer her immediate questions. And then we set up a time where we would have a physical interpreter come with her, assist her through the process of filling the application, providing her diploma, her resume, asking questions, her asking us questions as she was starting the process. When we set an appointment for her to be interviewed, we made sure she had an interpreter present during interview. When she was hired and we did orientation, her orientation in our classroom setting, which is done with all our new onboarding staff, was done with an interpreter at her side. Her orientation in her particular department, it entailed a 2 weeks, 3 week process. And during that entire time of her orientation, an interpreter was present with her for her entire onboarding orienting. Once she was comfortable with her level, her manager, supervisors was comfortable with her being able to function in her role, then the interpreter was not a daily thing. However, for meetings, for additional trainings, whatever else she requires, we provide the service of interpretation for her. Now, she has the ability to tell us, I think I can handle this and I don't need an interpreter today, and that's perfectly fine. And in some cases, it's a couple of word conversation and I kind of fill in as the buffer interpreter if she needs me, but she initiates what her needs are and we accommodate accordingly. So we have a mobile interpreter that not only provides interpreting services, but we also have the ability to assist with those individuals who speak English but low functioning perhaps and need a little bit more assistance. And so we provide those things for our employees.
Okay, wonderful. And that's a very good example in terms of really walking through the whole process from application into employment and onboarding. So again, it sounds like with Schneider Regional Hospital that not only do you have the process set up, you actually have resources set up to help those process. So that's really exciting. Okay, and I think Ms. O'Bain, no, did we get everybody? I think we did, right? All right. So what I want to do is wrap up the part about the ADA. I want to mention a couple of things to the audience. One is that if you need reasonable accommodation or you want to talk about that, that's mainly the reason why people disclose disability. To Ms. O'Bain's point, if you can't see the disability or it's not obvious, you can also call it DRCBI and talk to myself. You can give the Northeast ADA a call and talk to them as well. And there's also, I want to mention vocational rehab. Just for those folks who may not know who they are, they're another workforce system who helps people specifically who have disabilities. That's a barrier to employment, and they are one of our partners. So if you think you might need VR or you want to learn more about VR and how to navigate that and again, know what your rights are with that, you can give us a call. That's something that I do to help people get connected to VR. And the last thing I want to mention is our other partner with Department of Labor. That's another workforce system, of course, it's the largest one. And that is another partner of ours that you can go and get that not only specialization with necessarily ADA and reasonable accommodation, but all the other pre-vocationals like the resume, the mock interviews, and different types of potential vocational training, including Doug's, which he's part of that roster as well. So just to make sure that everybody knows that ADA, all employers are required to do, they have ADA obligations if they're 15 or more employees. And you as a job seeker, as a person with a disability, have a right to reasonable accommodation. There are also some responsibilities on both sides, and that's a training that we'll do in the near future. If anybody has very specific questions on that, again, follow up with me. I'd be happy to talk to you about your rights and responsibilities under the ADA with employment. All right, now we're going to move on to the screening process. And the screening process I will do in two parts. First part I'm going to talk about is the credentialing. And then the second part will be about different checks. So Miss Williams, I'll go back to you with the screening. And again, I know just like VI personnel, you have so many different classifications and different types of departments and positions. So to the best of your ability to be able to talk maybe, and even if it's just something as simple as what's the least amount of education it takes to get into the hospital. And then you can take it from there. And the credentials include things like education, certifications, and license.
So presently, the least education is a high school diploma or equivalent GED certification. Sometimes we have folks that come from neighboring islands, and so their education systems are a little bit different from ours. So verifying what type of education they receive for high school diploma relative would be necessary, but not impossible. As far as certifications and licensure, anybody who's working in direct patient care areas, particularly from CNAs, PCTs, LPNs, RNs, physicians, of course, those things apply. But any of the other positions, the minimum requirement is a high school diploma or equivalent.
Great. And I think you mean like support staff, whether it's the food service aspect, the maintenance, maybe administrative and other different types of non-medical certifications. So wonderful. Okay, thank you for that. Ms. O'Bain, in terms, and again, similar to the hospital, I guess such a wide swath of different credentials, but in terms of maybe the minimum requirement to be able to actually work for VI personnel and any other information related to certifications and license.
Okay, well, thank you for the question. Well, again, as mentioned, that the division of personnel is a central recruitment arm, and we're talking about hundreds of positions that are posted one time on our website. In a little while, I can actually give you that information so that they'll be able to go up and view our website. All right. So with that being said, some of the positions is a wide array of positions that starts from there's trade, craft and labor. There's also position that falls under clerical. There is law enforcement. So it really varies because some positions under the trades, they just require just some experience and not necessarily a high school diploma. Whereas positions like you apply for like law enforcement, police, corrections, fire, minimum high school diploma. However, if indeed you have a degree, you may be able to come in not just with a base salary for these positions, but also given an additional differential on top of that, which will then allow for you to even make more money from that. And then you're talking about positions that might be administrative, which could be a combination of training, education, and whatever, experience that you may have. All we ask that you do is, because all of our processes are electronic, you're to start your file, an application file, which is at our website. And then from there, you then view those positions, open them up, see what it calls for, look at the minimum qualifications, look for the essential functions, and see if this is something that you are interested in. And then we can then go from there. And again, my staff is always ready and willing to speak to you in regards to providing any kind of guidance, because there is so much different career pathways that you could actually just come on into the Virgin Islands government and not feel as if you have to stick to one agency. And the beauty of it, there's 26 agencies. So with your qualifications, with your skill set, your competencies, you may be able to transfer into another agency that you would be able to gain those additional skill sets. So thank you.
Yeah, and you mentioned two things, Ms. O'Bain. One is transferable skills. You mentioned that a couple of times. And it's so incredibly important to know that those skills that you have that are transferable can absolutely apply to other types of jobs. So that's why it's very important. As she mentioned, the essential functions of the job. That's why you have to read the job descriptions very carefully, know that you minimally qualify. And if you have some of those transferable skills, to make sure that you bring them up, whether it's your cover letter, whether it's in an interview, to make sure that they know you come with additional skills that can be crossover, and again, in this case, to different departments. So thank you for that, Ms. O'Bain.
You're welcome.
And then Mr. Rideout, with the credentials in terms of education.
We started everything in here with the medical billing. Now we're doing the medical coding. We have auditors, CDI. We actually do interim directors for C-suite category as far as leadership for hospitals. We have several layers that we can offer. So that goes back to, we'll start with the very beginning. To start out, as far as like medical billing, you can start out with a high school diploma. And we recently changed that that definition to in pursuit thereof, because some of the people in high school may want to start the training program. Okay. Some people may want to, during the process that are going through their GED, they can still go through it and they can start the process. So you don't have to wait. So high school diploma is kind of the basics. Okay. Any of the programs that we have, job positions that we have, they're either certificates, nationally recognized certificate programs, or in like for directors and other positions, of course, there'll be degree programs. Background checks is something that we need to make sure we touch on here. As far as
Doug, we're going to talk about that in the second round of questions.
Okay, all right, great. As far as the other piece of this too, as far as the ladders that you can climb, like I mentioned, you're starting with billing, you got coding, auditing, CDI, you can continue to climb up based on your passion and how well you do, and just if you enjoy this, if you're hardwired for this. So if you're willing to put the work in and open to the training, you can just continue to climb up. So that's kind of what's required, is your enthusiasm and willingness to get those certifications and education.
And Mr. Rideout does what's called, he refers to stackable certifications. And with the stackable certifications, I believe you can increase your salary $30,000 or $40,000, even 50 to keep going up. So this is an opportunity, like Doug said, that you can grow yourself. You can keep going up that ladder. in terms of certifications, and they're all there available to you in terms of how far you want to take this. Okay, now let's talk about the second part of the screening process, and that has to do with the background checks, as Doug started to talk about. So I'll ask each one of you to talk about, as it applies, background checks, drug tests, and any fitness for duty or physicals. So I'll go back to you, Mr. Ryder.
In the medical field, we need to make sure, and then Ms. Williams will confirm this. In the medical field, you can't really have a criminal record. Okay, that's pretty much the standard. You either have to have it, expunged or whatever the scenario may be, but you need to be aware of the field that you're going down in the training, because if you have a criminal record, that's going to just completely mean it's wasting your time. We've heard about several cases of this. So in another response to your point here, we're looking at other career fields working remotely in the technology world that will allow for people with a record. So we're looking at other options. Okay, we don't have them today, but we're working on that. But as far as medical, like we're speaking of today, that's one of the things that you just really need to be aware of before you start down that training path.
And I think it's incredibly important that you know what the employers require, because there's no need to. You have any kind of conviction, particularly a felony, and particularly if it has to do with fraud or anything, it's just not even worth applying to. So that's why these employers are here to tell you exactly what their parameters are and how you need to fit within those parameters, especially when we talk about background checks. Thank you. Ms. Williams, in terms of background checks, drug tests, physical or fitness for duty.
So at SRMC, we're a drug-free workplace. So pre-employment does require a drug screening test, background screening, like Doug said, is a requirement. For individuals who are onboarding, unlike other government agencies, we do require a physical and certain immunizations that you don't normally get as a child growing up or into adulthood through school are requirements of our institution, only because we are a healthcare provider and you can be exposed to a plethora of things in this field. So to protect our staff, to keep our employees safe, to provide services to the community and go home to their families safely, prior to employment, there are required vaccinations that is non-negotiable for the healthcare field. So that is a difference in our institution versus other areas of government where physical and additional vaccines may not be required. It is certainly required here at Snyder.
And Ms. O'Bain, again, in terms of the background checks, drug tests, fitness for duty, and again, on a general basis, because I'm sure every department varies with that.
Yes, thanks for the question. Yes, of course. All the department varies in terms of the different type of jobs. Definitely background checks is required, and some jobs may require for medical, some may require for what you call drug testing. So it depends. And that's why we always encourage you to open the job description, see what it calls for. That's where that necessary special qualifications may come in that you will be required to, you will be subjected to. But again, it's not all that will require that, it's just some, and again, we look forward to you joining the workforce. Thank you.
Great, thank you. I've done this probably 20 times in the last several years, these roundtables in person and online. And I can't tell you how many times people have shot themselves in the foot by disclosing something in the audience when, well, first of all, it was no one's business. And second, it may not have even mattered. So that's why, again, I say it's so important to listen to what the employers are saying, because they will tell you exactly what the parameters are. So you don't disclose something you don't need to, or you don't, shoot yourself in the foot when it wasn't necessary.
And you know what, Ms. Carr, I'm happy that you said that.
Mhm.
because of the fact that, remember I mentioned that we are equal employment opportunity employer. And it's important to understand that unless it's a bona fide occupational basis, until they give you a conditional job offer, you're not obligated to give that information up front. Okay? So thanks. That was
Yes.
perfect. And I need
And
to
I'm gonna keep adding to that, Ms. O'Bain, in terms of conditional offer. There's many stages of application to interview and then to a final offer. And it is a very complex matrix to go through. So if anybody would like to follow up with me, I would be happy to talk one-on-one about that because every situation is different. What Ms. O'Bain is referring to with conditional offer having to do with what we just talked about with the screening process. You will be offered this job based on these conditions. What can happen, just as an example, let's say that you have a false positive with a drug test and you take a prescribed medication, which renders that reading, you have a right to let the employer know that the reason that this is so is because of this. If you don't need accommodations, then you just disclose and there's no other further action that is taken on either part. The process continues to proceed and the person has passed the drug test because they have shown them that it's related to a disability and prescribed medication. That's just one example. And again, it's very tricky. So keep in mind in terms of all the different stages and how we can help you because you don't want to disclose and unless it's necessary. Research has already shown people with disabilities only disclose due to disability. And that's something as an advocate, myself and others, we make sure that we protect your rights, we protect your information, and also that, if you do want to disclose, we help you how to disclose it. All right. The last thing I want to wrap up with the screening process, and this is just anybody can jump in that applies. If you guys do any personality or aptitude tests, anybody can jump in. Personality or aptitude tests.
3 things that I always look for when we're hiring people. And I get this from my business mentors: attitude, appearance, and behavior. That kind of ties in with what others have said in the past as far as open and enthusiastic. But some of my business mentors help to start companies like Dell, and they give me the same things over and over and over. They say, when we look for people, we don't care about their background, we don't care about any disabilities, anything. It goes back to their attitude, appearance, and behavior. And that there's so many different levels on those. But if you have the right attitude, anything's possible. I mean, all of us here are willing to help you if you've got the right attitude, but you can't knock on the door once, walk away, and then wonder why I don't have a job. You can't apply 2 or 3 places and go, wow, I don't have a job. It's up to you to do that. You have to have an appearance as far as like when you're doing your job, you have to be professional. Everyone on here is professional. You need to look and emulate those things. And your behavior as business people, you're trying to go into the business world, be an employer. To be an employee, you need to show up. You do not need to show up late. If you show up late, and as far as I'm concerned, you're disqualified. If you're not early, you're on time. I'm old school. But at the same time, in healthcare, and you can't be late. You don't want your doctor to be late, so you can't be late. So, attitude, appearance, and behavior. If you look at those things and you're taking this seriously today about trying to join the workforce, just change your lifestyle, if you will, you have that opportunity today. But focus on those things, folks. And it applies to all of us, especially Shammy, attitude, appearance, and behavior. We all need to have those things. And if we have those things, it's infectious. Okay. It is infectious. Look at the smile over there on Millicent. Okay. If we do those things, it's good all the way around. It's people want to work with you. They want to be around you. So I want to hire people like that. And I just think that's how God meant us to be. We're blessed. And we just need to keep moving forward and doing good things. But attitude, appearance, and behavior, that's what I look for, and we'll keep promoting always. That's all I got to say.
And Doug, in terms of whether it's a process or a screening tool or, an online tool, the personality aptitude can be just something that organically is you're going to figure out if this person has all of that you're looking for without necessarily using a screening tool of sorts. So very good.
Do you find those things out in the very beginning? Because when we're communicating with people, like you said in the beginning, you've already told everyone how to communicate with us. If they don't, and I'm getting phone calls and I'm getting text rather than what you just said, that's kind of tells me right in the beginning, they're not really that's a screening process. So,
Right, definitely. Ms.
So,
Williams?
in the reality, we get hundreds of applications for a plethora of positions that we have. We cannot interview every single person for those positions. So there are different stages that occur based on the application and the resume and degree, diploma, certifications received. We go through those, we make phone calls, we do what's called pre-screening for some of those individuals to determine if this is a good fit to move to the next level of a physical interview. Now, when I say physical interview, meaning meeting with the hiring managers, supervisors who are actually going to determine if you're a good fit for their department. And that can be done in person, as well as we also offer it via Teams. So you may not be able to physically come into the building. However, you can do that interview via technology and still show up on time, still show up professional, still be able to do those things that in the past you had to be physical to be able to show that. And like Doug said, you have to be on time. Your attitude, your behavior, your demeanor from on the phone etiquette, from that pre-screening right up to that physical interview has to convey who you are and how you're going to fill the niche for us as an institution. Even for some young people, the type of email address you provide, yes, you may have an email address that speaks to your personality or whatever, but when you're looking for employment, that email address that you're providing, there should be a professional type email address, whether it's just with your name and the handle, but not things that give off strange habits. That's not something an employer wants to see. And that's a first indicator, is this going to be a good fit for my institution? So just food for thought. All of those things play a role in whether or not you become successful in attaining that particular position.
I'm so glad that you brought up about emails, because I cannot tell you how many inappropriate emails I've seen. And I don't even think I want to say them online, but that is the #1 indicator of the level of professionalism. Also, in emails, do not disclose, do not put the year that you were born. People think I'm like a magician because I know what year they were born. You just look at their emails. Oh, 1970. Oh, you got 70, you got 68, you got 74. Oh, are you this age? It's not magic. It's easy to figure it out. So again, we don't want to deal with age discrimination, but do not put your year that you were born in your email. Ms. O'Bain, did you want to add to this?
Oh, definitely. Now, what a lot of folks don't know is, again, we're the actual hub for the Virgin Islands government. So what means there's hundreds, sometimes thousands of applicants that applies for all the jobs that you will see there. Do not get discouraged. You see something you want to apply for, go right ahead. Check out and look into, research the different environments to make sure that is where you would want to work. And as what Ms. Williams indicated, when we go ahead and we send the names to the hiring managers are the one who will then decide now through the interview selection process, who best fits, to move forward in the next step of the process, which may be a virtual or in-person interview. So not because you may not have met that or reached to that level, does that mean that you're not the best. But always remember, maybe it's because of the fact that there's 70% of the jobs in the Virgin Islands government, they're part of a collective bargaining agreement. Always keep that in mind. So we have to make sure that indeed the hiring managers hire these folks or promote them, because the Virgin Islands government have what you call promotion policies that require that is done. So do not stop at that. Do not be discouraged. But again, because of the fact that there are so many different agencies, so many type of jobs, open it up, review it. And if you have questions, please call us. We'd be more than happy to provide that guidance to you. So I just wanted to say that to the listening audience. Thank you.
And I want to jump in something you said that sometimes comes up and sometimes doesn't, that's unionized environments. And just so you know, if anybody, is interested in working or is wanting to be part of a unionized environment, such as with VI personnel, and has a disability, there's actually a brochure on collective bargaining agreement, the CBA and the ADA. So we even have that information. So I'm glad you brought that up, Ms. O'Bain, about that. So, all right, wonderful. Let me close up by saying in terms of this section with the screening is that a lot of employers will use personality and aptitude tests to screen out folks in terms of behaviors in the workplace. You have to be very sure that you don't screen yourself out and you read it, you interpret it correctly. What they're trying to do is to see how you would react or behave in the workplace. And so I've had this with folks who talk to me who have mental health disabilities, who have other conditions, maybe not mental health, but it affects their psychological well-being. And some of those personality tests can be difficult or maybe misinterpreted. So please, if that's something that you've dealt with or you find that to be a barrier, let us know. We can try to help you or get to folks just so that you can do those screening process and put your best foot forward when you do those. Okay. All right. We're going to start closing down in terms of our last couple of questions, and then we're going to open it up for Q&A. So one of the things that makes an employer a choice employer is their promotional opportunities. And so I remember when I first started doing this, there was a bank who said that 80% of the promotions were within. And when I hear an employer that says 80% of the promotions are internal, that means that they absolutely invest in their employees. And so I think a lot of job seekers want to know, is this an employer that's going to invest in me? And what does that career ladder look like for the organization? So with that, I'm going to start with Ms. Williams and again, generally speaking about career ladders and kind of if you have a sense of like your internal promotions.
So like Ms. O'Bain say, in the government, we do handle CBAs for different, and here at the hospital, we have 9 different unions. So we have some similarities when it comes to promotional levels, because of course the CBAs do indicate promoting from within, and on a government on a whole, promoting from within is always the way that we go. So we do have options within your particular department to promote from within. We also have the options of transferring to another department to a higher position or another position. We also offer our employees a educational online platform called Relias, where you have the opportunity, no charge to you as an employee, to enhance your training, to enhance yourself, whether in the current employment department that you're in, or whether you're seeking to advance yourself into another area that we employ in. And it's, again, no charge to the employee. As an employee, you have that ability to choose those classes and take them, get certificate hours for them. And with that information, can apply for that other position or job and possibly attain it based on education. So we're investing in our employees through that platform, giving them an opportunity that is cost-free to them so that they can enhance themselves if they truly want to move into another area. And what we found, sometimes we have folks, let's say they come in as an entry-level individual in security, but through their time here working with us, they're more interested in the nursing field because they collaborate in those departments and they see an area that they're interested in. They have access to this online platform where they can actually take certification classes, get certified in certain areas, and utilize that to advance themselves. So we certainly promote from within first and foremost. We do reinvest in our employees through methods of education, and we continue to encourage them to self-advance.
Wonderful, wonderful to hear. Mr. Rideout?
Well, this is exactly the reason why our healthcare companies started our own training program 10 years ago. we had great people. We had great people working with us, and they needed additional skills as our opportunities came open with different hospitals and job openings, and we would have to go out and hire other people. So, but we had these people we knew that were already in the organization. So we developed our own school right at 10 years ago. And it's just a mechanism, a part of our organization now, to where if you're in the organization and you choose to commit and you want to take that training, you can climb the ladder. Because I want to promote those that are already in the family and showing up early, staying late, getting the job done, and a part of the organization, and have a heart for what we're doing, not just a paycheck, but they want to be a part of the organization. And they understand that's it's important to the success of that organization and their success. So absolutely, we have to have that ladder to climb. And with M1 and anyone we work with, there is a ladder to climb. It's as far as you want to go. It basically is up to you. It's up to you.
And it's so true with what Doug is saying, is because he talks about those stackable certifications. He talks about these advancements that you can take, and that is the career ladder. And again, I know that I just want to express again that all of Doug's jobs are remote, all of them. Okay, and Ms. O'Bain, in terms of career ladder, and whatever examples you'd like to use, because I know you got a lot.
Well, of course, there are so many different career ladders. And again, each agency is different, but just to name a few. Department of Planning and Natural Resources, they may have some that's specific to their organization, such as whether you wanted to get into fisheries, you have fishery biologist 1, 2, 3, then you have the chief and all of that. Then you have now those that are generic to some of the agencies, which might be more than 20 of the agencies I've mentioned earlier, that may have administrative career ladders. And you're talking about administrative secretaries, then you can become ad officer 1, 2, 3, administrative assistant. Then from that, you can actually go across, and then you can become a coordinator of admin services, or you could go up and you could become an office manager, or you could become a program administrator, and I could go on and on and on and on. So there's different ladders and different jobs. So again, it is very important that when you look at a particular job, look to see what the agency has to offer, find out a little bit more about it, and do not stop yourself from limiting. Should I say, do not limit yourself to any one. There are so many opportunities in the Virginia's government. And again, if you're not certain, we are here to help guide you. Thank you.
Definitely. I know all of us have been to job fairs, and probably good in the audience. And when you go to a table and the recruiter's really not really into it, and they don't have a lot of enthusiasm, they're not employers you want to work for. You want to work for employers who are highly engaged, like Ms. O'Bain, like all of our recruiters, that really show a level of engagement and a desire to recruit the best talent. And so again, that's why, it's just great to see the enthusiasm on both ends, both for the employers and recruiters, but also for the job seekers as well. All right, I've got one more question to ask, and then we're going to open it up to the audience. If you've got your hand raised, you're welcome to put it in the Q&A, or you can leave it raised until we open it up for actual Q&A, and you can unmute yourself. Okay, so the last question I want to ask, and actually it wasn't on your guys' questions, but it's just kind of a takeaway for the audience, is if you want to just highlight some of the benefits of working at your place, whether it's career opportunities, whether it's salaries, whether it's retirements, medical benefits, whatever the benefit is, if each one of you just want to mention some of that. And I'll start with you, Ms. O'Bain, because I know you have a lot.
Come on. Yes, indeed. Yes. The Virginia's government, again, there are so many myriad of job opportunities, but I'm going to mention this. Some of the great, excellent benefits include, room for advancement, affordable group health insurance, medical, dental, vision, life insurance, competitive salaries. We have what you call overtime differential, hazardous pay. We have accrued vacation leave. We have sick leave. We have certifications, memberships, all that may be covered. We have relocation costs, and each one of the agencies may have some additional benefits, but these are some of the general ones that I've mentioned. And I would say, think 26 different agencies that you can actually apply for jobs, up to 26 actual holidays that you actually get paid for. And again, this is the other 26. Keep this in mind. And 26 pay period for the year, not 24. So I'm saying all that to say to you, the GVI is hiring. This is my opportunity, as you always say. You know, you have the talent, you have the skill sets. Come on, join us. We're ready for you to join this workforce. Thank you.
That's right. Ms. O'Bain is definitely the best cheerleader for sure of her agency. So that's wonderful. All right. And, you know, I just want to express also with VI personnel is that if you have any young people on, Ms. O'Bain, can you say exactly how many years somebody has to work before they can retire?
It depends, because that falls under the retirement office. So some of us, if you're in tier 1, of course, they say you could be up to age 55. If you're putting 30 years, you know, you can actually get an off of that. Or if you're over 60 and you did at least 10 years. So it's different brackets, different tiers, you know, but again, there's excellent retirement system. And we would like for you again to be able to be a part of us so that you can understand that all of these great benefits are right there available for you. Thank you.
Great. Thank you. Thank you. Okay. And Ms. Williams, and just whatever benefits you'd like to speak to.
So I'll mirror Ms. O'Bain because everything she shared as far as benefits are the same for us. In addition to full-time employment, we offer temporary employment, per diem employment, and part-time. And so for folks, relative to per diem, we have some staff, particularly nurses, who are living in the States for most of the year. However, every couple of months, they come back to the VI and they're here, let's say on vacation, or even while they're advancing schooling, and they have the opportunity for becoming a per diem employee and working with us when they're here in the Virgin Islands. So they're not sitting at home for a couple of months doing nothing. They can give up their time and get compensated for it as well. That's also offered in different levels of maybe let's say they have a second job or another job, and they're only available to work on the weekends from Friday, Saturday, Sunday, and they want to give of that time. That is also an option. So there's a variety of other options for employment with us as an employee of Snyder with your varied needs.
And I think that's something that more and more employers are becoming much more flexible. You know, they're looking at telework, they're looking at per diem, they're looking at part-time opposed to full-time.
And internships.
And yeah, definitely. And the good thing is that the world of work has changed so much that being able to do these different types of flexible workplaces, it does become kind of a reality. And Ms. Williams just talked about some of that. So thank you. And Doug, I know you're in a little bit of different boat, but anything you want to talk about benefits?
Well, Ms. Williams stole my thunder. Okay. One of the things I get the most excited about, because it impacts me directly too, is the flexibility. If I want to get on a plane and go see the grandkids, I can. I still have my job. If you need to go help a parent, you need to go help a child, you can go anywhere you have the internet and cell phone signal, you can work, you can keep your job. So it gives you the flexibility. And a lot of people, when they get to the point where they're retired at a certain job and they want to do something, they'll start doing this. Or it's also a different work-life balance. The next generation, the new generation, they want that work-life balance. It's hard for me to kind of understand sometimes, you know, because I'm not hardwired like they are, you know, so forgive me. But I've got 6 kids, and so I'm looking at how they look at things, and I keep hearing this work-life balance, and I'm like, what does that mean? You know, so they want to have that flexibility, you know, that Ms. Williams talked about. They got to have that. That's a part of how they're hardwired now. So it's just, that's what we offer. And if we don't, we're going to miss out and continue to have a shortage in workforce if we as employers don't adapt. And that's what we've been doing since 1999 when we first started moving into remote workforce.
That's a very good point. Very good point. Okay, with that, we're going to go ahead and open it up to the audience. Kishma, if you can maybe help facilitate that between the chat, or anybody wants to be unmuted.
Yes, hi, good morning, and good afternoon to all. Our first question on the floor is, what if you become partially disabled while working and your employer will not accommodate and not offering you another position? States it's a liability for them, no light duty. Employer ended up, or should I say employee ended up filing for disability and not working.
Okay, why don't I take a stab at that first and then have the employers jump in as they wish to supplement specific to their situation. And so if you become partially disabled while working with your employer, it depends on how you got injured. If you became disabled at work and it's related to work, then that's a workers' comp case. And that's very specific and very regulated through the employer. If it's a situation where you have become injured, not at work, but because you work, but you maybe got injured at home or somewhere else outside of work, but it affects your work, that's a different scenario. And that's where you would go then to talk to the employer about the fact that now you have a disability and you might need reasonable accommodation and you want to start that conversation. Okay. So I think it's important to know that if they're not offering you, as an example, reassignment, which means that they're offering you another position that you can do based on your abilities. And if they don't have reassignment or they cannot reassign you because it's not an option, that could be viable. But again, there's a provision in the law that talks about undue hardship. And so when we talk about accommodations, it always comes down to, is it a hardship for the employer to provide it? Is it going to cost too much? Is it going to disturb the operation? Is it going to change the operations? And if it does any of that, then the employer does have a justification not to provide that accommodation. But it is a big conversation. And again, I encourage you, you got the Northeast ADA Center, you've got myself to help you walk through that process. And I'm going to open it up to the employers if you'd like to add anything more to that.
We've had employees that have been diagnosed with, whatever, and they've come back to us but due to their treatments, they've not been able to keep their regular work schedule. So with our model, with the flexibility, they just scale down and they work around and they work as they can. The work still has to get done. So we may assign someone else temporarily to that workload for a hospital to make sure the coding gets done, the billing gets done. But when that person comes back, then they are able to come back and pick up their original workload.
Now, I remember you telling me about someone in that specific situation too. And, I think when we think about work in the past and what we call traditional work, if you were out X amount, there really was no negotiating. It was either you use up your time and there's no flexible leave schedule and, there's no situation like Doug, so pretty much out of a job. And whether that's discriminatory or not, it's a secondary question. So here's a situation where Doug just explained, because it's remote and it's at your pace, even though you have to have deadlines. This is a possibility where if you do have an onset of a condition, it still could be worked around it, as Doug just mentioned. Anybody else want to jump in with that?
So within a healthcare setting, on the requirements, because doing your job doesn't necessarily mean it's all paperwork and you're non-patient facing, you're providing services to the patients, to the community. And depending on what your position is and what that particular disability is, if it affects being able to safely provide services to that customer or patient, or for you to be safe in providing it, then we look at the best practices, meaning if we can accommodate in another area temporarily, if it's a temporary situation. If it's a more longevity situation, then we have to look at the entire thing holistically. Are you able to function in the job you were hired for? Are you able to continue to do what's required of that particular position? And then if it's deemed that it is not safe for you or the customer or the institution at that situation, then other options would be looked at, whether you can be accommodated in another position. But keep in mind, accommodations in that type of situation depends on whether it's a permanent disability or if it's a temporary disability, whether those accommodations could be made and for how long. Then there is a possibility of looking at doing a reassessment and determining if you fit that job any longer with that disability, and making other accommodations, giving you other options to determine whether this is still a good fit job-wise, health-wise, safety-wise for you, the patients, and the institution.
Ms. Obey?
It was articulated by Ms. Williams, and that is so true. And that's why we always promote, hiring managers, to be able to follow the laws, adhere to these different CBA languages to make sure that indeed you do your best as management to accommodate your employees. And if they are unable to provide that essential or perform those essential functions, and whether it's temporary or on a permanent basis, they will be able to come up with some sort of agreement as to what best fits, both parties. Thank you.
Let me just also mention, because it was brought up twice now, at least, is temporary disabilities. And the ADA, the Americans with Disabilities Act, does not cover temporary disabilities. It only covers permanent disabilities. And so just be mindful of that. There are some rights that you have if you have a temporary disability, but that's not under the ADA. Okay? Let's go to the next question.
Okay, we have, question just popped out. Okay, Miss Taylor, I'm gonna open your mic. Your hand is raised, so you can speak.
Hey, good afternoon. I wrote in a Q&A and it's all typed there.
Okay, so I'm gonna go ahead and read it for you then.
Okay.
Okay. It's
Sorry, big truck just went by. Excuse me. What did you say? Oh, you want me to say it orally? Okay. I have some concerns with the frequently used adjective of, quote, enthusiastic, end quote, in a job candidate. Due to past experiences and or disability, the affect of the candidate may clearly not come across as enthusiastic. So that's my first one. Although their trainable skills and character may be a good fit for the position. Secondly, what about the difference between stupid special ed certificate versus a high school diploma? There we go.
Okay, Ms. Taylor, I'll conquer that and then again open it up to the employers. So the first one having to do with the enthusiasm, and you heard the employers say that as well. It's not just the job seeker advocate saying be enthusiastic. The employers want to see that too. But there's different levels of enthusiasm. Just to give you an example, there are people who have autism who have a difficult time having eye contact or maybe handshaking. Maybe they have a sensory thing where handshaking is difficult. Some of the vocational supports can help facilitate that. Maybe they're not going to be buddies and give the old dap and all that, but they're going to learn how to do a professional handshake to the best ability they can. And so I would encourage, if you know anyone, to be able to use some of those support services to get them into a better place to be interviewed. So the enthusiasm can look all different. Another example is that a person sometimes shows their enthusiasm by doing written descriptions, having a portfolio, giving examples. And that's a way to show that there's a level of engagement. And so before I answer the next one, which I will answer the next one, I want to throw this to the audience. Throw this to the employers to ask them about alternatives to the adjective of enthusiastic.
That's a good question, because autism does limit people in their responses. So you made a good point. Enthusiasm, it's like I said, a good question. But if I'm getting someone that's emailing me weekly, and I tell everyone this, I said, if you want this job, if you're interested in this career, this training, just contact me once. You're not very enthusiastic. So I encourage everyone, no matter what their disability may be, and I stick to the belief that we all have a disability in some way, shape, or form, but be enthusiastic the way to deal with this, be enthusiastic by being consistent. I call it being relentless. If you really want that training, you really want that job, I'm going to get tired of hearing from you, and I'm finally going to hire you just to deal with it. I want enthusiasm, and that can come across through just knocking on our door and being just being serious about it. So you had a very good question. It is a realistic question because some people just have trouble with the eye contact. They have trouble speaking. And so the way to answer that is just keep knocking on our door, emailing us, whatever it takes to get our attention.
So Kathy, hi, how are you? Enthusiasm, like Doug says, and like Shami says, is on different levels. Part of our screening process is being able to determine what that enthusiasm may look like for an individual. Like Doug mentioned, somebody who's constantly emailing. I'll give an example. We've had a young lady come in literally almost every week for months, filling out applications for positions that she feels she can actually attain, and constantly coming in. Now, you can visually see that she has a cognitive situation. She's very polite. She engages in conversation. It may not be to the level of other people, but she definitely makes the effort. She has what you would call an IEP certificate. But last week, she attained 2 different interviews in 2 entry-level positions. And in that interview, it was considered a courtesy interview, but in that interview, she got that opportunity to learn what that position entailed more than just reading the job description. She had the opportunity to say to them, I can do that. No, I wouldn't be a good fit for that. I can't do that. Then moving her on to a second department interview where the position she was being spoken about isn't something perhaps she can do 100%, but it gave the director of the department an opportunity to say, you know, I do think that we can reevaluate our positions. We could potentially use this young lady in a different position that we can bring back to life that we had years ago, and she may very well be a good fit. So let's hold on to her while we reassess our department and see if we can certainly employ this individual. So that isn't a hard enthusiasm as in hyper, and you know, there are different levels of it. And I guarantee you, the employers who are doing that initiating process, who's doing that weeding through process, sees the different nicks and can determine where that goes. And for us, for instance, like we said, we do provide our managers, directors, supervisors with a little bit of history when we see candidates that needs that just a little bit more sensitivity. And so they do take that into consideration during the interview process with them.
Ms. O'Bain, did you have anything more to add?
Oh, I think they covered it all, but hey, why not add a line or two? Listen, my thing is to the listening audience is that I don't look at it as enthusiasm, but we look at it as, I would say we look at it as you being passionate. You look at it as you being purposeful. We look at it in terms of if indeed you do not meet the final cut for a particular position, we always ask that the hiring managers have a position, look at their organization and see if they may have another position that they could actually have that person apply for and see if they will be a better fit. So again, you know, I'm always going to come with this. The GVI is hiring. Give us that opportunity. Do not limit yourself. Thank you.
And let me answer the second question having to do with special education versus high school diploma. Those are very 2 different pieces of paper. The special education basically is a certificate saying that you completed something. It does not hold any merit. It does not have any credits attached to it, unlike a high school diploma. Someone can be in special education and still receive a high school diploma because they're following the credits they need that's needed for graduation. So those are two different things. When someone is applying and it says high school diploma and you have an IEP diploma, I'm not saying that's lying, because some people don't know though that there's a difference. But do know, if you do know there's a difference, that would be falsifying your application, because those two are not the same. Okay. All right, I see we have some more questions, Ishmael?
Yes, we do. Is it possible to provide a listing of vacancies that need to be filled immediately?
I'll
So
leave
in the
that to the
chat,
employers.
I put our website linking directly to careers that provides you with the list of positions, the synopsis of the job description, and in some cases, the actual onboarding entry-level salaries as well. And you can fill the application online, provide your certifications, diploma, degree, and resume online that comes directly to us as well. And through Division of Personnel, you can also do the same and connect with us as well.
We have done the same thing as well, Ms. Carr, that we've listed that information. And again, go on up, scroll on through and see what exactly it is that you are interested in applying for. And please do your best. Apply, start the account, attach the documents that is required to move it through. And then you will be able to get notification, automatic notification as to whether or not you have actually met the qualification or anything in regards to your qualifying status. Thank you.
And Doug, did you want to add anything by chance?
Not at this time. Go ahead. I'll let you go to the next one. I'm reading through the other questions, trying to get ahead of you here a little bit.
Okay.
Right.
All
All right. Our next question: what opportunities do your organizations have for seniors 55 years and older who want to re-enter the workforce?
I can touch on that.
Sure.
The great thing about what we're doing here, we have a lot of people and seniors. My goodness, I'm more than say 55, but okay. It's not age. We don't have no age discrimination. If you can do the job, that's all we're worried about. That's all we're worried about. There's working remotely has that flexibility, and we have a lot of people that are 60 plus, and they just said, you know what, I have a purpose. I want to be involved. I want to keep a mind sharp, and I want to make more money. So they get certified and they work remotely. So there's no age limitations with working remotely.
Nope.
And on this end, of course, age is not a factor. We do have people who have retired and want to come back in. We have hard to fill positions, for instance, like nurses. And so there are some accommodations through the government that allows our retirees to re-enter and work with us for maybe a period of 2 years without having to worry about their annuities. And then if they want to come back on a more permanent basis longer than the 2 years, then we can go through that process. But in filling those hard to fill positions, we always have that opening. We have some folks who retire and decide, I don't want to do anything too strenuous, but I still want to come on board. We have the need for patient sitters, someone who can sit with our patients who could be potential fall risk and assist our nursing staff ensuring that our patients are safe. So there are opportunities. They just need to take handle of it.
Oh, you waited for me.
If you would like to add anything else, I've got one thing to
Well,
add
of
to that.
course, I'm going to add. Well, under the Civil Rights Act of 1964, Title 7, it is understood that there is no sort of discrimination. Okay, so it does not matter what your age is. You could bring something to the organization. Please apply. We are going to do our part to make sure that indeed you're given the equal opportunity just like everyone else. So it's no such thing as you're too old or you're too young. You're living, you have transferable skills, you meet the qualifications, and indeed we have jobs to fill. So with our community being so small, we want to ensure that everyone, again, is given that fair chance. And again, there's 5 generations of talent, and the Virgin Islands government always welcome everyone to at least give us the opportunity to help you to move forward in the process. Join the workforce. Thank you.
And let me close this section up, this question up by mentioning two things. All of the employers talked about what's called the ADEA, which is the Age Discrimination Employment Act, similar to the ADA. And the ADEA is actually 40 years and older, which doesn't seem so old to some of us who are much older than 40. But that's a non-discriminatory policy that they're referring to. I also want to mention specifically, there is a program just for seniors. It's called the Senior Community Services Employment Program, or CSEP. It's out of the Human Service Office. So give them a call if you're looking for a specific program that's for 55 and older. That I believe it does pay minimum wage, but it is there's some employment opportunities as well.
And may I add to Ms. Carr that if you were a former government employee and have retired, we have also, because of a legislation that was just passed, we also allow for what you call a retiree re-entering program. So if you're interested in that, please, you can reach out to us. We'd be more than happy to provide more information to you. Thank you.
Okay, our next question on the floor. Do any of the agencies give tools for persons that are visually impaired?
So let me start that question, because employers have the obligation of providing reasonable accommodation, which can sometimes mean that they would purchase maybe what we call assistive technologies. And again, I want to give a shout out to VIU Said. I know we have Ms. Williams who's on with us, and they do a lot of assistive technologies. And so it could be that the employer pays for it, whatever that software or AT looks like, as long as it doesn't cause a financial or operational hardship. I want to add to that vocational rehab, who's a partner of ours, does provide some resources related to this. So if you have a visual disability, then you would be able to talk to them and see, this is an employment barrier, I need some software or some assistive technologies, and many times they have the resource to pay for it. And then they work in conjunction with the employer to make sure if it's a software issue that it lines up with their IT, and so the IT department gets involved to make sure everything's compatible. But there are resources, and typically VR is a good resource for that. But if any of the employers want to jump in about anything with AT or accommodations related.
As far as the accommodations issues that we've dealt with, Jamie, you've helped us the most with this. When we had that one situation, we reached out to you, and we basically were able to, we went ahead and purchased the large screen monitor for her, but going forward, we now have a path where we can use your services as well. So, yes.
And if that question is geared towards visually impaired individual who's already employed, then of course, the accommodations that's relative to making sure that they're able to do their jobs will be provided. And in most cases, those individuals are more than likely looking for things to make it larger, like Doug said, whether it's a larger monitor or the ability to have software. So those accommodations would certainly be made as they are needed.
Okay. We are just about on time. Ms. O'Bain, did you have anything more? Because we'll start wrapping up.
No,
Okay.
Ms. Williams actually covered that area. And,
Okay.
Thank you.
Okay. So again, a bit of advice I can give to people who are listening, job seekers, if you think you might need some assistive technologies, do know that vocational rehab is a very good resource for that. Also, VIU Set can help with trying to understand the different types of AT in the workplace. And so again, let us know and we can help you follow up with either one of those or both of them. So I want to wrap up by first giving each employer 10 to 15 seconds to give your best advice to the job seekers about working with you. Doug, we'll start with you first.
Sounds good. Thank you so much. As far as about to work with us, I suggest that you don't wait till tomorrow. You start today, and I need to see an email from you today that says what your interests are, and so we can start a dialogue to tell you what steps you need to take next. So don't procrastinate. Do it now.
Good advice. Good advice. Ms. O'Bain, how about you?
All right, my advice would be market yourself.
Yes.
Apply even if you don't fully qualify. Attend job fairs, research the agency, interest in terms of the work culture, network with our HR professionals, know yourself, know what you want, showcase your abilities, don't turn down any opportunities, and always have a positive outlook and prepare for the next move in your life. Passion, purpose, that's public service. Thank you.
Excellent, excellent. And Ms. Williams?
I'll emulate what Mr. Bain said. Give yourself the best fighting chance by enhancing you, promoting you.
And again, I want to mention that DRCBI, along with myself, can help with that. Vocational rehab can help with that. Also, Department of Labor can help with that. These are all workforce system or all work advocates that can help you to put your best foot forward so that you do get that equal employment opportunity, what these employers are talking about. So with that, we're going to wrap it up just to be mindful of people's time. We thank you for attending today. We will be sending an evaluation. We appreciate any feedback that can better this program. I want to personally thank each one of the presenters. I know you're all very busy recruiters, are very busy people. So I just want to thank you for your time. They've given you information how to follow up. If there's anybody on here who might want to talk further about any of these employers, your particular situation, you can give me a call. And with that, I bid you guys all a good day. Stay safe and stay well. And thank you again. Have a good day. Bye-bye.
You got me. Bye-bye.
Bye.